Welcome back to the Health Perspective. Today I'm joined by clinical psychologist Dr. Ilan Ben-Zion. In this episode, we're talking about relationships and communication, what actually goes wrong between couples, how to repair it, and how parents can communicate better with their children. In my experience as a GP, relationship difficulties can often play a huge role in our wider well-being. So whether you're in a long-term relationship or navigating family dynamics, I'm certain this is going to be a useful discussion. Ilan, welcome.
Thanks for having me.
You're welcome. Obviously, there's so many things that a GP and a psychologist could talk about. And when we were kind of brainstorming before this, you mentioned relationships and relationship difficulties. Why was that?
It's just coming up all the time at the moment. It's coming up people looking for a relationship, people in a relationship, people that have come out of a relationship, marriage, parents wanting to look after the relationship with their children. It comes up in most sessions or with most people I work with in some form or another.
So a core theme. And why is it coming up? So why is it underlying other psychological problems? Kind of why is this such a big theme?
I think there's huge reasons it's a big theme. If you look at the way in which we interact in relationships, we interact online, we interact offline. We have many different types of relationships with friends, with family, and people are starting to learn a bit more about how to look after these things and talking about it and understanding where it's difficult and where it's not. Okay.
So if we start with the most broad question, and this is a really tricky one, what is a healthy relationship, or what is health from a relationship perspective, and can we even define that?
That's an excellent question. I think that if you think about what do you want from a relationship, you want to have your needs met, but you also, in a really healthy relationship, you want the other person's needs to be met, right? So it's a reciprocal thing. It's a reciprocal relationship. So I think really you're getting your needs and your feelings met and heard, and also they are as well.
Okay. Because I think that's a really great, very, very gentle definition, because, a lot of the things that I've encountered are things like people's expectations might be along the lines of, the absence of conflict or emotional safety. And sometimes I think those expectations can be a little bit unrealistic. What are your views on that?
Yeah, absolutely. The idea of this ideal or perfect relationship, I don't think I've ever met someone with a perfect relationship. I'm not sure it's really the absence of conflict, right? I'd say it's the presence of conflict, but conflict in a healthy way, right? You want to be able to not have conflict, but be able to discuss difficult subjects or have difficult conversations, but in a way that is healthy and actually progresses the relationship and moves it forward to, into a better place, so that maybe those things don't happen in the future again.
And I think the reason that I wanted to discuss it with you, and I thought it was a great idea, and many people don't realize this, but as a GP, I think people think that we see things, medical problems day in, day out, which have clear diagnoses. So someone comes in with abdominal pain and it's appendicitis. Someone comes in with ear pain and it's an ear infection. Someone comes in with a headache and it's, it's a migraine or meningitis or something. But in actual fact, up to 70% of people who come into GP surgeries, their physical complaints don't have a foundation in a physical illness. That's not saying that their complaints aren't real. It's just saying that their symptoms aren't necessarily explained by an easily diagnosed physical illness. And so as a GP, my role is to kind of dig under the surface and look at what else is going on. And psychological difficulties, and specifically relationship difficulties, really, really come to the fore. So I think it's a really good time to be having a discussion as well. What are the three commonest issues that couples come into you with, do you think?
People are already in a relationship. It may be things like conflict, arguments, which is usually related to some sort of communication in some way. Maybe some sort of joint values, how they see the future and how they envisage what their future is. Or difficulties in terms of parenting, or how they want to parent, or difficulties with their children, differences in opinions and things like that are probably, three of a number of difficulties that come up.
Okay. Well, then let me ask, what are some of the other ones then?
Honestly, as I said earlier, like the relationships are the core of so many difficulties and great things as well. But you can have someone who maybe family difficulties, like wider family difficulties, the way that people interact with them. It could be friends. They like their friends. They don't like their friends. all sorts of areas, because the relationship it impacts on every area of someone's life, and in that sense, that can create a difficulty.
Do you think that we have unrealistic expectations of relationships? And what I mean by that is, I think that nowadays, our generation and younger generations are much more psychologically attuned, but also kind of in our heads a bit more. I don't think our parents and our grandparents necessarily worried about whether their relationships were good or not. Now, that doesn't necessarily mean that their relationships were good, and maybe things like abuse and things like that, were pushed under the rug. But I guess nowadays we're much more likely to be asking ourselves, is my relationship right for me? And am I getting what I need from my relationship? So I guess the question is, do you think we have unrealistic expectations, and are we too in our heads about our relationships?
I think two reasons come to mind that might explain that. Number one is, I often talk to my clients about the pasta sauce dilemma. And that basically is where you used to go into a supermarket maybe 30 years ago and you'd have two types of pasta sauce to choose from. Now you go in and you can literally have a different type of pasta sauce every day for the rest of the year. Now, why would you take the third one if you can try a different one every day and maybe find a better one that you're going to have, right?
Right.
So the idea is that there may always be something better. Why would I have this one when I can have something better? So what that does is it means that people are looking for the perfect relationship, and maybe, of course, not always, but not accepting the one that they have now or working on it. The other challenge that comes up is, of course, now we have much more access and exposure to Netflix, to TV shows, to the idealization of relationships on TV and the perfection that they might be portrayed as, which means that we want that relationship that we see on TV or portrayed on TV, which, of course, is a TV program, not reality.
So that's a really interesting one, actually. I completely agree. So, and what are the unrealistic ideals you see portrayed when you're watching TV late at night or whatever? What are the things that you see as most problematic that are portrayed, whether it's on TV, whether it's on social media, and how that plays out in your consultations, I guess?
I think it's the idea that there's either an absence of problems, where obviously there's just a perfect relationship and everything goes from meeting for the first time to marriage and perfect life, or there's the presence of problems, but they never escalate to anything more than anything else, right? It's something that's nipped in the bud there and then and isn't particularly a problem. What you don't see, not always, but often you don't see the real raw difficulties that go on in a relationship and the day-to-day struggles, having to, your baby is awake all night, you get up, you're both tired, you've worked all day, there's an argument, that you don't see that as much in a TV show, and that's, so people haven't got a healthy model, a day-to-day human model that most of us would experience to compare to.
I think that's a great point. I think that, and in many ways, sometimes TV can be helpful for this, and social media as well, because I think the other difficulty is people don't necessarily see the real difficulties that can arise from external factors in relationships, and I guess in my role as a GP as well, I see people with unimaginable difficulty in their lives, like couples where a child has been diagnosed with cancer, for example, or they have a teenager with severe mental health problems or an eating disorder, and the strain that puts on relationships in the family. And actually, I do see, this is one area I do see positivity in social media and general media, TV and film, but it's a difficult line, because obviously there are between the unrealistic expectations and the ability to bring that story to a wider audience.
Yeah, absolutely. There are some amazing role models or people that speak on TV about their struggles, and there can be some really good possibilities to identify with someone with the same difficulties and to understand their struggle. And actually, of course, seeing someone else go through it is not necessarily the solution, but it can help to know that someone else has the same struggles as you.
Yeah. So another broad question for you. What is good communication in a relationship?
Good communication in a relationship is thinking about your needs and your feelings, and thinking about the needs and feelings of the person opposite you, in the most simplest of terms.
Okay, so let's expand on that now. So how does that, that's very easy to say sitting here.
Absolutely.
But if you're in a heated kind of argument at home, or if you're in a particularly difficult stage of your relationship, that can be quite difficult to play out. So how does that actually play out? How do we kind of expand on that?
So the best way I can explain how it will play out in a relationship is, what I can do is I can tell you what not great communication
Yeah.
is, okay? And what will happen is you'll see a couple maybe sitting in a room talking, and what they're doing is they're just lobbing statements at each other. You did this, you did this. There's no question. They're not trying to understand the other person. They're not trying to understand their point of view, their perspective, what happened. There's an absence of an effort to understand and learn. And actually what that's replaced with is usually defensiveness and blame. And what we're trying to move away from in good communication is from defensiveness and blame and towards understanding and learning and curiosity to understand what's actually going on between us as a couple.
And there's another important thing that you mentioned there, which is the you did. And instead of saying I feel, can you just dive a bit deeper on that? Because I think that's really important too.
100%. One of the things I wouldn't use this language as strongly, but I try to ban as much as I can is what's happened in the past. What I don't want is, someone drops something on the floor and it's like, well, 20 years ago you did this, and it's not relevant. It's not useful, right? So what we're trying to move towards is, this happened and it made me feel like this, so that you're explaining, you're not blaming. You dropped the egg on the floor, or the egg was dropped on the floor and it made me feel angry. Right? There's no blame, and it starts off a conversation which allows the other person to respond without it heating up or blowing up in some way.
So what you're saying is it's not about ignoring those things that happened in the past. It's not about saying they're not relevant, but it's about the way that you're framing them and the way it made you feel, rather than in an accusatory way.
We'd 100% talk about previous experiences. We wouldn't want to ignore them. They're useful to understand and to develop understanding between a couple. But what I try to avoid or try to prevent is those experiences being dug up in every argument. So you have an argument today and you've got arguments from last year, 2 years, 3 years ago coming up, when actually it's not necessarily relevant to that moment. What it's doing is it's just adding fuel to the fire, and it's making something bigger that's not actually that big.
So I'm trying to think, as you're talking of I guess some take homes for the people watching. I'm always trying to think of an example scenario here to play out. But give me a common one that comes up in. Is there something kind of common that comes up in relationships? I guess without being too cliche. Whether it's about someone not doing their share of the housework, for example, how does that play out in a way that how can you communicate that in a different way?
So let's say that came up. That's a good example, right? Someone needs to get something from the supermarket. One person doesn't want to do it. So the other person says, I always do the washing, I always do the cleaning, I've done the dishwasher, I've cleaned the house, whatever, et cetera, et cetera. And what the alternative way, instead of using that sort of a previous experience to make their case, is they could say, I feel really tired and I need to rest right now. Would it be okay if you did this?
All right, but had to push back on you.
Go for it.
To push back on you, then the other person was like, well, I also feel tired. What about me? I've been working all day. How do we stop that entering a cycle of personal needs, in a different way?
Absolutely. And there's there's good justification for both people, right? In order to not go out and get what that is from the shops. And what's most important is that there's an exchange of views, and someone takes that lead to go and do the activity. At the end of the day, the activity needs to be done.
Yeah.
They both got reasons not to do it. But what we don't need to do is to escalate it into a big argument of I did this, and just lower the temperature. And then, I could go and get it, and maybe you could do it next time.
And it's important to say this stuff is hard, isn't it?
Oh yeah.
So we both have our own relationships, and it's very easy. I think we have to acknowledge to people watching, it's very easy to sit here and say these things, but to put them into practice it's a lifelong challenge, isn't it?
I'm delighted you said that, because every single thing we do is, the vast majority of things we do is relationships, friends, work colleagues, partners, whatever it might be. And we're navigating different relationships with different people.
Yeah.
And they have to be all dealt with in different ways. It's a minefield. It's so difficult. I absolutely agree. These are not easy things to do. And no one is going to get it right all the time. Yeah. That's really important to remember. You're not always going to get it right. And that's okay.
It comes back to not being too hard on yourself. I'm a bad spouse, I'm a bad partner, I'm a bad parent, and just kind of giving yourself some praise and I guess self-love.
Yes, steering very clear of like, I'm a bad parent.
Yeah.
Those very concrete, labels, which are just not fair or useful.
Yeah. Is what we're talking about, because I've heard the term non-violent communication, is this what we're talking about?
Absolutely. We're talking about moving away from blame and defensiveness in communication and more towards understanding, curiosity, looking at someone's needs, looking at their feelings and understanding things better in a much more accepting and non-judgmental way.
Okay. And from my perspective as a GP and as a doctor, and I think one of the things that I do a lot of is I look after and help a lot of people with mental health difficulties. And I see the role that mental health difficulties and also neurodevelopmental conditions like ADHD, for example, can play in relationships. But I guess I'd be interested to hear your perspective and understand, to what extent do mental health conditions or neurodevelopmental disorders play a role, and specifically, I guess, also undiagnosed conditions like depression and anxiety in a partner or spouse.
They all will strong, maybe too strong, inevitably, or highly likely have an impact. Okay, if you look at things like depression, that's going to be not always, but often characterized by maybe withdrawal and isolation, not wanting to speak, not wanting to engage, not wanting to see friends. So very much withdrawal. And then what you see from that is because people are withdrawing, they're not engaging day-to-day life, which then puts pressure on the content of their conversation. They feel like they have nothing to say because they're not doing anything, which makes people not want to do those things, which makes them more depressed, and it impacts these relationships more.
Yeah.
Right. So you can see it that's just in one difficulty, depression, low mood, whatever. You can see how it can play out and impact on relation and snowball into something greater and actually feed back into the depression as well.
And before, because I think we should pick up on a couple of others, but before we move on, I think it's also worth mentioning the medical aspects of it. So, depression also leads to, so like you said, increased negative self-talk, increased feelings of self-worth, and probably you're more likely to think, I'm a bad partner, I'm a bad parent. But also depression leads to increased levels of fatigue. So you're probably more likely to get into conflict about who's going to do the supermarket shopping or whatever it is that needs to be done. Depression leads to often kind of self-neglect, but also to sexual problems as well, kind of reduced libido, or even the medications that we use for depression. Common antidepressants can lead to reduced libido, erectile dysfunction. So for me, these problems are inherently cause difficulties in relationships. Let's talk about anxiety. So how does anxiety in an individual play out in a relationship?
So, of course, there are different types of anxiety. You could have anxiety because you're anxious about, let's say, social anxiety, for example. You're anxious about being with friends and you don't know what to say, or you're worried they don't want you there. And therefore, what you do is you withdraw and you don't go to that engagement. Let's bring it back to, let's say, a romantic relationship, though. You may not want to do things. You may not want to go out because you're anxious, which means you don't go out, which then affects your partner, right? Because then you're both becoming more isolated as a result. Of course, it's not intended at all, but that's the result of that's one example of the result of anxiety on a relationship.
Okay. And what about neurodiversity? Because I think this is a big topic at the moment. It's going to be too much for us to cover in one go, I think. But how do you see undiagnosed or even diagnosed neurodiversity affecting relationships?
Of course, there's huge amounts of variation here in diversity in presentations, etc. But let's look at something like autism, where that can be characterized by various different ways of social interaction or quite rigid thinking patterns at times. Now, let's say you're in a relationship and it's undiagnosed and the other person doesn't know. They might just think, why is he being so difficult? Why is he speaking to me like this? Why does he keep doing this thing in this way? Not understanding that actually it's part of a difficulty which impacts on the way in which they communicate or interact with you, rather than an intentional or a purposeful slight on you.
And this is a difficult one, but if you're seeing a couple and you spot these difficulties in an individual, would you try to bring that out and would you try to discuss that?
Discuss it on the level of, I think you might have some sort of neurodiversity
or mental health difficulty like anxiety or depression. Because I guess if you're doing couples therapy, but you spot really, really significant unmet mental health needs in an individual, I guess it's kind of your responsibility to bring it out.
Absolutely. And actually, what you find 9 times out of 10 is that I will bring it up quite sensitively and gently, but actually, most of the time people say, I've thought about that before.
Right.
Right. Like, oh, yeah, actually, there is. I don't know, my dad's autistic or has autism, and actually it's most of the time it's something that people have thought about before and actually are aware of, and what you're doing is you're just bringing it into the room and making it something you can talk about,
Right.
and it gives permission to everyone to talk about it and to actually be quite open.
Yeah, and I definitely find that in my practice as a GP, often when you're trying really delicately to say something, I think actually, the way you're feeling probably indicates you might be depressed and you're quite worried about their reaction. They actually turn around and say, I'm so relieved you said that, because literally I've been Googling the symptoms last night and I was thinking exactly the same thing.
It just gives permission to say something people might be holding or struggling to know if it's relevant or if they can even say.
Okay. So should people be scared of couples therapy? You obviously do this. This is something you do. What actually happens in couples therapy?
I love doing couples therapy. Honestly, it's one of my favorite things to do. For me, it's something that you could give me any couple and there would be something that they can do in their relationship to make it better, right? Couples therapy is not about blaming person A or person B. It's saying, this is what I do in the relationship. This is what I do. How can we make this better together? How can we make our relationship even better? Sometimes it comes from a position of it's really difficult. And sometimes it comes from a position of we're just trying to make it better than it is already. For me, any couple can improve things. And it's just a chance to, in a really non-judgmental, non-blaming way, to talk about things and try and improve them in a really respectful and fair way.
Is it something people should be scared of? I think people are quite avoidant of it. And I think that relationships often break down because people haven't given couples therapy a go. Is it something people should be scared of? I think people get quite worried that it's going to, dive very deep. I think people get anxious that they're going to be uncontained and they're going to expose all and they're going to be fighting in front of a therapist. In reality, what do you see?
In reality, it's number one is I am very much led by what the aims and goals of this work, right? So I'm not going to go somewhere which doesn't feel relevant or feels unsafe or uncontained unless I feel like that's needed, and I'll do that in a careful way. But it's not a scary experience as it may seem. And actually, we're there all for the same purpose. We're there in the room because we want to make things better. It's a very positive experience. I think going to a psychologist is a positive experience because you're there to improve things, right? So the direction of travel should be really positive. So I think people's expectations should be, I'm going to go there, we're going to have a chat. You need a skilled and experienced therapist. Absolutely. Because you're working not just with one person, which is difficult enough. You're working with two and you've got to be on everyone's team at the same time,
right?
Which is a skill in itself. But if you walk away thinking he was on my side and both people walk away with that, that's the perfect job, and that's what everyone should walk away from it feeling.
That was brilliant. I couldn't have I said that better myself, I guess. If a couple's having difficulties, they explore couples therapy, but one person just won't attend. Stubborn, fear. Is there still value in the other person attending?
Absolutely. So again, two answers. Absolutely. Simply, there's always value in someone coming and talking things through and getting understanding of what their role in the relationship might be. I'm not going to speak for the person that's not there. It's unfair. But they can certainly understand their contribution to it. The other way I sometimes say is I ask the person, can you bring your partner so that they can tell me what you do wrong, right? So it's not about them. Right. I'm just bringing them to help me because I want to hear that. I want to hear their voice.
Yeah.
Right. If you do everything wrong and your other person's perfect, I want them to tell me what you do wrong because it's a different perspective.
Yeah.
So there's different ways. It's either individual or they can assist if you want. There's different ways in which to, but it's always useful. I believe, or we try to make it useful.
And I guess, giving people hope who are watching as an experienced therapist and couples therapist as well. Do you see hope for couples? Do you see couples coming to see you with difficulties who improve their relationships in the long term?
Absolutely. Absolutely. I have nothing but respect for couples who are turning up week in, week out, or whatever regularity it is, and it's not an easy experience at times,
Yes,
right? You're talking about
uncomfortable.
difficult subjects, and what you're doing is you're putting yourself out there. You're making yourself vulnerable in order to make your life and your loved one's life better. And that's the people to put themselves through that to make things better. I think is very respectable, and it's a great thing to do.
So let's move on a little bit to parent-child
Mm.
relationships, which is a completely different subject area. And again, an area which I see a lot of fraught anxiety and problems at the moment as well. I think for lots of reasons. I think we've got social media, we've got kids on smartphones, we've got adults on smartphones as well, to be fair. And, I do see a lot of parents struggling with their relationships with their children and teenagers. What are the commonest problems you see in terms of parent-child relationships?
There's many. It depends on which domain you want to talk about. But I suppose one of the main difficulties, I think, comes from, and this is the same with any generation, is that the generation of parents grew up in a different generation to their child, right? So that the way that you experience your childhood will be different to how your child would experience a childhood. And therefore, your understanding of how a childhood should be will be completely different. You wouldn't have grown up with screens every single place, right? And it's that mismatch that makes it difficult, because a child is saying, this is the world I'm growing in. And a parent is saying, no, this is what the world looks like. And they have different expectations, and that causes a lot of conflict.
Okay. And what things can parents do, to improve communication with their children? And I guess that's kind of a summary question, because we've discussed general communication techniques so far, but there's been a bit more of a leaning towards, I guess, couples. So in terms of parents and children, what are the key tips you give to parents in terms of how they relate to their children?
So this is a more simple version, and I appreciate it's not this easy. But if you look at a baby, when a baby is born, you know it's hungry or not well because it's crying, or it's giving you some sort of indication that there's a problem here. And you learn very quickly and effectively as a parent, that is what that cry means. It means the baby is hungry. And as children get older, they don't cry maybe, or maybe they do, but their method of communication changes. And what you're looking at is you're looking to understand their new method of communication to see what their needs are. So it may be that they're angry. Are they angry because they hate you? Or are they angry because they've had a really tough day at school, or their friends don't like them, or they're sad, or they're anxious? It's starting to learn to understand them, because what they're doing is they're communicating.
Yeah.
Right? When you're an adult, it's easier to hide it. But actually, as a child, it's more raw. It's not as refined, and you can really learn a lot. And it's starting to understand both verbal communication, what they do, but also what they say, but also non-verbal communication, what they do and what that means as well.
Yeah, I love that. And it reminds me of something else someone told me, which is when you've got a child or a teenager, or just like kind of a primary school child, like an 8 to 10-year-old, who's kind of acting up or really angry or having a complete breakdown at home. What this person said to me is to remember that child inherently, usually, wants to actually be good. So most children don't want to decompensate or fall apart or have an emotional dysregulation. So if they are at that point in time, then there is something triggering that. So as a parent, I think sometimes you're inclined to, you're stressed, you're tired, it's the end of the day, you're inclined to see it as a decision, or see it as they just want to behave bad today, but actually switching that framing and thinking in your head, this is a good person, this is a good child, their natural inclination is to be good, but something is preventing them from doing that at this moment in time. I know for me as a parent, that's been a very transformational shift.
Yeah, absolutely agree. If you have that approach, it changes everything. It changes the whole way you frame a person's difficulties, right? And it can do that with a child. It can do that with a partner.
Yeah.
But if you look at the child as inherently good, then absolutely, then it changes the way, and it means you might be less angry about that person or that child and what their behavior is.
Okay. Should we be friends with our children? A lot of people say, my dad's my best friend, or, my son is my daughter's my best friend, or whatever it is. Should we be aiming to be friends with our children? Is there a different relationship? I think this is one people get really caught and stuck on, and perhaps overthink more than we need to.
The truth is, I don't think there's an answer necessarily to that. I think the role of a parent is to be to the child what the child needs. If the child needs a friend, and you can be that friend to the child, be that friend to the child. If they need a bit more boundaried relationship for all sorts of reasons, then be that boundaried parent, right? You're molding yourself to the child's needs. That doesn't mean that you have to be a disciplinarian all the time. Of course, you can have the more lighthearted, fun relationship as well, but it means that you're not always the friend or always the disciplinarian. You are the parent that they need in that moment, because what that does is it models how the world works, how relationships work, and it gives them a model to live their life by in the future.
Yeah, because children also need to understand that relationships aren't perfect. I mean, if you grow up in a conflict-free home, you're not going to learn how to handle conflict in the future. So modeling something to children that's not realistic is not going to actually help equip them for the world.
Yeah, 100%. That the aim of a parent is not to be perfect. It's to show that you're not perfect, and this is how you deal with imperfection.
Right.
Right.
Yeah. Useful advice for me as a parent, I guess.
For anyone in any aspect of their life, right?
So just to close up, I think my final question for you is, what's one thing you wish every couple knew? Every couple out there, whether they're having difficulties, whether they're not having difficulties, if there's one thing you could communicate to them before their relationship falls apart or they hit major difficulties, what would that one thing be?
I would tell them that we're all on our, I'll try not to sound too cliche here,
Okay.
We're all on our individual journeys with our own stuff. We've all got our own background. If you meet someone when you're 30, they've got 30 years of history and life before that is contributing to everything they do, comes from all of that experience in their life. And we have to remember that what we see, someone being angry or upset or whatever it might be, in that one moment, we're seeing one moment. What we're seeing is 30 years worth of life that have led up to that one moment. Right. And it's the compassion, it's the understanding that might not be about you, that moment. That's a whole lifetime of experiences led up to that moment, and having understanding for that and seeing the inherent good, as you mentioned earlier, I think is a really powerful message.
Thank you. This has been a great chat, and I think genuinely has some great take homes. And I hope everyone who's watching can bring some of those take homes about bringing compassion and understanding into their relationships.
I hope so.
Ilan, thank you so much for joining me.
You're welcome. Good to be here.